we will discuss what a tremor is, the top 7 causes of tremor, and how to identify and treat each one. A tremor is an involuntary rhythmic muscle contraction that leads to shaking movements, usually in the hands. Other possible parts of the body affected include the head, vocal cords, torso, and legs. If muscles receive excessive or insufficient signals from the brain, they can contract, which we perceive as a tremor. Almost 80% of tremors are physiological, meaning they are benign and not caused by any specific disease. Generally, we have low amplitude, fine contractions of muscles that we don't perceive. However, during stress, after caffeine consumption, or when the nervous system is excited, this trembling becomes more prominent and noticeable. The main mechanism of such tremors involves stress hormones like adrenaline and noradrenaline, which increase muscle sensitivity and excitability, making muscle contractions more noticeable. In cases of tiredness and fatigue, muscle control decreases, making involuntary contractions more likely. During hunger and low blood glucose levels, stress hormones are released, causing hand tremors during hunger periods. These are classical examples of physiological tremors and do not require any specific treatment. Addressing the underlying cause is usually sufficient, such as limiting coffee intake, ensuring adequate sleep and rest, and eating regular small meals frequently. Managing stress through deep breathing, yoga, and meditation also helps. The second most common cause of hand tremors is essential tremors. In this case, tremors usually occur in both hands and are more pronounced during voluntary movements, such as writing or eating. This tremor worsens with tiredness and stress and improves with rest. Sometimes this tremor affects the head, causing nodding motions, and the voice, causing quavering. Essential tremor is frequently familial and genetic. For treating essential tremor, beta blockers, especially propranolol, are used. Sometimes anti-seizure medications like primidone or benzodiazepines, such as clonazepam, are used for their muscle relaxant properties. Reducing caffeine and alcohol intake and engaging in regular exercise improves the condition. Deep brain stimulation, which involves implanting electrodes in the brain to help control tremor activity, is sometimes used. Without treatment, the condition worsens over time and significantly decreases a person's quality of life. The third most common cause of hand tremors is Parkinson's disease, a neurodegenerative disease that gradually leads to the loss of dopamine-producing neurons in the brain region called the substantia nigra. The lack of dopamine is associated with tremors. It usually starts in one hand and is prominent during resting, decreasing when the person is active. It typically starts asymmetrically, beginning on one side of the body and eventually progressing to the other side. A characteristic of Parkinson's disease is the pill-rolling tremor, where the thumb and index finger move together in a circular pattern, resembling the rolling of a small object or pill. Over time, movements become slow and inflexible, a condition known as bradykinesia and rigidity. People with Parkinson's disease often have difficulty balancing and coordinating, leading to postural instability and frequent falls. Parkinson's disease is also associated with depression and cognitive impairment. Parkinson's disease progresses over time, and without treatment, significant disability can occur within 5 to 10 years. However, with proper treatment, people with Parkinson's disease can live almost a normal life expectancy. Without treatment, life expectancy is much shorter. The primary treatment for Parkinson's disease is levodopa medication, which is converted into dopamine. It is usually used with carbidopa to reduce side effects. Parkinson's disease is more common after age 60, but some symptoms can appear after age 50. It is twice as common in men as in women. The exact cause of Parkinson's is unknown, but genetics, hormonal balance, and environmental factors play a role. Chronic constipation, fatigue, and hyposmia, loss of smell, can be early signs of Parkinson's, even years before a tremor occurs. Although levodopa increases dopamine levels, it does so gradually and does not cause euphoria, unlike substances of abuse that cause dopamine spikes. Other drugs that mimic dopamine can also be used in combination with levodopa. These medications include pramipexole, ropinirole, and rotigotine, transdermal patch. The fourth most common cause of tremor is medication-induced tremor. Stimulants like caffeine, amphetamines, and methylphenidate can cause tremors by increasing dopamine and norepinephrine levels, leading to muscle cell stimulation. Antidepressants, such as fluoxetine, Prozac, sertraline, Zoloft, and tricyclic antidepressants like amitriptyline, can also cause tremors by altering serotonin and norepinephrine levels, which can affect motor control. Antipsychotics, especially haloperidol, Haldol, risperidone, Risperdal, and olanzapine, Zyprexa, can cause tremors as well. Asthma medications like albuterol, Ventolin, and salmeterol can also lead to tremors. Other medications, like levothyroxine, can cause tremors too. The fifth most common cause of tremor is hyperthyroidism, which increases thyroxine levels, leading to increased metabolism and muscle sensitivity, resulting in hand tremors. Treatment in this case involves controlling hyperthyroidism. Hyperthyroidism is more common in middle-aged women, and the tremor is constant during rest and movement. Another cause is multiple sclerosis, an autoimmune disease that progressively damages motor neurons, leading to numbness, vision problems, and tremors. However, multiple sclerosis is rare and not considered a common condition. The seventh cause of tremors is alcohol withdrawal. Alcohol is a central nervous system depressant, and when its depressant effects are suddenly stopped, the brain becomes hyperactive, causing tremors, sweating, restlessness, irritability, and anxiety. Benzodiazepines are the mainstay of treatment for alcohol withdrawal. They enhance GABA activity, helping to reduce the hyperexcitability of the nervous system. Examples include diazepam, Valium, and lorazepam, Ativan. Sometimes, tremors can be caused by psychogenic factors and not linked to any specific disease. Anxiety, depression, or stress can commonly cause such tremors. Additionally, neuropathy and other rare diseases can cause tremors, but these cases are less likely.